Hello, my dear colleagues. Today we will discuss clinical epidemiology and evidence-based medicine, the basic concepts, because it plays important role for you in your professional life, in your professional sphere. You should know how to read different publications, what to read, where find these publications, and another main points for your professional level. You see outline this lecture. The first point associated with history of clinical epidemiology, main stages for developing these discipline, and then you see definition clinical epidemiology and evidence-based of medicine, and some points about stages of evidence-based of medicine. Then we will discuss objectives of evidence-based of medicine, then the basic principle and keywords of evidence-based of medicine is necessary for your understanding of this topic. Then classification different questions, because they play important role for your find when you try to find professional information in your sphere, when you try to decide what method or treatment better for your patient, one or another method, and why one or another method is better than the first and the second, and maybe the third approach, and so on. Then you see the main points which we will discuss: sources of information, because you should use evidence sources for your professional publications, and levels of evidence based of medicine. At first, we start with the stages of development of medicine. As you see, we have three stages. The first stage is associated with empiric medicine, when we try to use different chemicals, different fluids for treatment, for saving our patient from different pain, and so on and so on. The next stage, experimental medicine, when we try to find more better approach, more better drug, or more better words in some combination with the treatment for our patient, for improving his condition, his disease, and so on. And the last period associated with evidence-based of medicine, clinical epidemiology, and nature stages for our sphere, for our professional approaches for our patients, and so on. You see very strange picture, and you think why I want to show you this picture, because I want to demonstrate you very strange myth which developing in human population when we try to use such necessary method for for preventive protective our patient from such dangerous disease like rabies. And you see that this picture demonstrated that people who received different dosage of this vaccine, they have some problems with some parts of their body, because they see different animals like crows on these parts. The first myth associated with vaccination was demonstrated one medical journal some years ago in France, and now we haven't such strange situation, but we have another myth associated with some treatment approaches or preventive methods like vaccination and so on and so on. So you see that when we describe situation with professional level, we will discuss sources of information, but you see that last time a lot of different sources of professional information every day, a lot of publications appear, and you have an opportunity to read all these publications for your professional level. You should choose which publication you should read for your professional level. You see that nowadays development of the pharmaceutical industry values advertising scientific publications, a lot of different drugs, vaccines, and another medicines create every day, and you should choose your more safety, more effective drug or vaccine for your patient or for himself, of course. Creation and implementation in new drugs. It's very serious situation because we have a lot of examples when we use some drugs and then we receive some destroy situation with our patient health. For example, you see very serious situation associated with the thalidomide disaster when during pregnancy women use such a drug like thalidomide, and then the children receive very terrible defects associated with their heads and legs. Some of them haven't legs and hands. Some of them haven't ears, eyes, destroyed function, respiratory system or heart and another organs. And of course these children in some days later they from these terrible defects associated with using thalidomide, their mother. Thalidomide disaster play important role for first step or for forming, for developing clinical epidemiology like a science, because this disaster was a very serious trigger for scientists, and they should to protect situation associated with using different drug. You see in 1938 famous person John Pearl coined the term clinical epidemiology, and she used this term like a new basic science for preventive medicine. because he they understood that it's necessary for medical sphere, because we try to protect health and life our patient from different factors, different pathogens, different factors, different um, adverse reaction, and another serious situation. So clinical epidemiology is a discipline that puts into practice the epidemiological principles into the clinical environment, focusing on patient, of course. And you see that the main position in this sphere associated with a good diagnostic and treatment for ill, for our patient, saving their life and first, and then having the opportunity to destroy their health or physical function, and so on. What role is playing clinical epidemiology in healthcare sphere? You see five recent evaluation on their health area associated with clinical epidemiology, and you see that they associated with the evidence generation, critical evaluation, efficient storage and recovery, evidence-based of medicine, of course, and evidence synthesis. In 1992, Saket with colleagues decided to substitute the term clinical epidemiology for term evidence-based of medicine, because meaning that every medical action of diagnostic, prognosis, and treatment, or preventive methods, and other methods which we use in medical sphere must be sustained in quantitative solid proofs based on the best epidemiological and clinical research. And it's mean that all method on intervention which we use for our patient, the first will be safety, of course, and then effective for our patient. What methods use clinical epidemiology? You see five methods, like formulate question or maybe hypothesis, choose a study design. It's a very necessary position for receiving evaluate results, choosing study population and sample from that, collect and analyze data, and of course interpret results. You see that clinical epidemiology competences includes some position like understanding of how bias and chance can affect the accuracy of observation in the individual patients, then evaluation of the validity of original articles, our diagnosis, prognosis, treatment, and prevention, then knowing the strength and weakness of different clinical trials. It will be randomized clinical trials, or maybe case control studies or cohort studies, prospective and retrospective, and meta-analysis. Then, using practical strategies to judge the validity of clinical evidence synthesis, like reviews. Then, comprehension of the mean, using, and the limits of the statistic power. It's necessary for understanding risk factors or triggers which play important role for patient health or patient disease, for example, knowing how to measure the patient preferences, and of course cost-effective analysis. This slide shows you a lot of different information sources for your professional growing. You see that it will be journals, medical journals, of course, newspapers, medical newspapers, books, articles, conferences or congress, or maybe different blogs, postcards, documents, official normative documents, different video files, websites, and so on and so on. And you see that you have a lot of different sources of information, and you should decide what you should choose in this case. What information sources is more preferable for you, more evaluate, more necessary for your professional level, for your growing like a specialist in different sphere. This question in 1972 uh, played important role for Professor Cochrane, and he with his colleagues and students decided to summarize and organize different sources and different parts of information for clinician, for medical staff, for their understanding how to should use different drugs, or maybe different diagnostic or surgical approaches, or maybe preventive measures, more effectiveness and more efficiency and more safety for the patients. And he and his colleagues tried to summarize all information, all publications, and then give for medical staff very briefly main positions associated with medical approaches. You see McMaster University in Toronto, where Sackett and his colleagues Yard work in 1919s, and he and his working group um, try to form all approaches, all algorithm and stages for future scientists, for future medical staff, how to choose professional information, how to find professional information, which publication is more preferable for professional level, and why. They create different concepts. So you see that they analyzed a lot of sources of information, and you see that a lot of researchers joined to this group, and you see that establishment of the Cochrane laboration should be considered as one of the critical factor in spreading the concept of evidence-based of medicine worldwide. And you see that this group try to create systematic reviews and meta-analysis, because they play important role for understanding which clinical trials we have in our days, and how these clinical trials help us to decide or solve medical problems with the patient condition. So at first we start with the definition, epidemiology definition, because you see such term like clinical epidemiology. It includes two words like clinical and epidemiology. At first, we start with epidemiology. What does mean epidemiology? You see that epidemiology is the study of the various factors influencing the occurrence, distribution, prevention, control of disease, uh, which we analyze in human population, of course. So epidemiology works with the human population, a large human population. What does mean clinical epidemiology? Like a definition. You see that clinical epidemiology is the study of the patterns, causes, and effects of health and disease in patient populations, and the relationship between exposures or treatments and health outcomes. It's necessary for your understanding, because areas of research include disease screening, prevention, systematic review methodology, comparative effectiveness research, developing evidence-based practice and policy guidelines, or another patient-oriented or patient-centered registers and data marts within health information system, creating and testing our patient for solving some problems, for take a decision about treatment in his or her conditions, and of course improve situation which you see in this moment in your patient, and realize a different research project. Of course, it's necessary for developing different parts of medical sphere. You remember that clinical epidemiology, like a term, change was changed on term evidence-based of medicine. What does mean evidence-based of medicine? Evidence-based of medicine is the process of systematically reviewing, pricing, and using clinical research findings to aid the delivery of optimum clinical care to patients. If you try to, or if you wish to say more briefly, more short, about the definition of evidence-based of medicine, you may use such science like evidence-based of medicine is the logic of healing. So the next important position for your understanding of what does mean evidence-based of medicine, you should think about different objectives of evidence-based of medicine, and you see five main objectives, like translation information needs into question, the first position, the second position, and identification in the world scientific literature or different information sources, the best evidence-based, of course, information to answer the professional question, then critical assessment of evidence or usefulness, applicability information, then implementation of the results of this assessment in medical practice, and assessment of the results of their work done, because it's necessarily like a feedback about your intervention into human body or part of human body, and improving their condition, health condition, of course. We move to main elements of evidence-based of medicine, and you see that evidence-based formed part of the multifaceted process of assuring clinical effectiveness, and the main elements includes four parts, like production of evidence through research and scientific review, then production and dissemination of evidence-based clinical guidelines, then implementation of evidence-based cost-effective practice through education and management of change, and the latter position, evaluation of compliance with agreed practical guidance through clinical audit and outcomes focused in incentives. We move to the basic principle of evidence-based of medicine, and you see that this principle based on the benefit and not treat where there is evidence of no benefit or harm. Its relevance at all levels. It's necessary for your professional understanding. When we try to introduce different methods on diagnostic or treatment for your patient, you should evaluate different risk factors and triggers. So when we characterize all approaches, all parts of implementation or parts our diagnostic approaches or maybe treatment, we should remember about three key words which is associated with the evidence-based of medicine practice, like intervention, knowledge, and assessment. When we characterize intervention, we should understand why we take a decision, use this approach, or maybe this drug for treatment, and of course our answers were based on accurate and modern knowledge associated with the evidence-based sources, evidence-based publication approaches, and results. When we use critical thinking, when we studying a lot of information, professional sources, then we should assess, we should form our assessment about these information, and then we take a decision about using or not these approaches or methods in our patient, in our practical sphere. An understanding of the evidence-based allows the clinician to tailor treatment to their circumstances and risk-benefit profile of the individual patient. It's very necessary position for all spheres. It does mean that every specialist should remember about this point. So you remember that when we describe situation with evidence-based of medicine and clinical epidemiology, we describe situation with formulation or creation different professional questions, and you remember that we have two types of professional questions, like basic and special. Basic question includes such words or terms like who, what, where, when, how, why, and they include two parts. The first part, which I list with different words like who, what, and another position is the root of the question. And then we have the second part like a verb, who is more susceptible for coronavirus disease, or maybe who got a more serious complication associated with the coronavirus. I mean, age patient, or maybe he is conditions like diabetes, or maybe heart diseases and other diseases, and so on. And you see the second type of professional questions like special, and you see that these questions associated with such abbreviation like PICOT. What does mean PICOT? What parts include this term or this abbreviation? You see that this term includes 5 elements. The first element, P, patients, E, intervention, for intervention studies only. Then component number 3, comparison group. Component number or element number 4, outcomes. I mean, diseases, or maybe death, or complications, and in other positions. And the latter position, time. You see a very simple example for your understanding how we understand how we use a special question like PICOT abbreviation. And you see when we move to the first position, patient, it was pregnant woman. Intervention using thalidomide. I described thalidomide disaster on the first slides of my presentation, and I show you that this drug we use for pregnancy women in 1947 till 1957 years. When we characterize comparison group new, because we use this component and receive such terrible defects, terrible complications only associated with the pregnancy woman and their child. And you see outcomes, different birth defects. I describe these defects like destroyed eyes, without ears, without arms and legs. In some such cases, they have children had arms and legs, but they were like destroyed parts, including their length and their functions. And you see one time during all pregnant condition, if a woman use this component, this drug thalidomide, her child received such terrible birth defects. When we describe the logistic behind evidence-based of medicine, I want to prescribe for situation: the person or population in question, the intervention given, the comparison if appropriate, the outcomes considered, of course. So we try to analyze, to describe different sources of information, and I want to demonstrate that in some situations there are many sources of information to inform clinical practice, and you have difficulties with choosing, but where can we find information to help us make better decisions? We see a lot of publications, more than 10,000 or maybe 100 and so on, and we understand that we haven't any time for such publications, and we try to choose 5 or 7 publications for our understanding this problem and solving the situation in our practice. If you try to choose, you should use Crane library like a very useful and the most valuable resources for your professional level. You see link on my slide, and I recommend you to use this link for solving problem, for getting information and taking decision about patient's condition. Of course, you may use different sources like Medline, PubMed, or other sources on the different journals. But if we try to analyze all information, you should choose publication which includes systematic review, or maybe meta-analysis, because they include a lot of publications which were describing different parts of our planet, and then they were joined to one publication, and you may use or read only one publication, but get information about all clinical trials which were realized in different parts our planet, in this sphere, in this problem. I want to demonstrate critical appraisal because every clinician strives to provide the best possible care for patient, of course. However, given the multitude of research information available, it's not always possible to keep abreast of current developments or to translate them into clinical practice. And one must also rely on published papers, which are not always tailored to meet the clinician needs. When we analyze information, it's necessary to you search for and locate it, price it, interpret in context your problem, your professional problem, implement this approach for your patient, store and retrieve it, ensure its update, and communicate it. Because when we communicate with our colleagues, with our friends, our scientists, we try to analyze a lot of sources of information which we receive from these colleagues, and then we try to summarize this information in your brain, and then produced your understanding, your idea for solving problem with the patient condition. As you see, evidence-based of medicine is not a purely academic or financial exercise. Its implementation has major clinical implications. I want to demonstrate you some cases for your understanding, and I use Cochrane library like evidence source for professional information. And you see that we will discuss management of fever in children, because fever is common in the under fives, and also usually benign may cause convulsions in children, and you see that in some cases our patient use paracetamol, in some cases they use ibuprofen as antipyretics drugs, and in some situation many parents, or maybe you, use two combination with these drugs, and some patient believe that this will enhance speed of resolution. But is this belief based on reality? I mean, evidence-based of medicine practice? Yes, no? What do you think about this? As you see, this publication demonstrate evidence level 1 plus, and you see that when we describe situation with paracetamol in mono variant or alone variant, you see that this patient had one chance of stop to protect fever convulsions. And if you see another position like no two combinations of this drug, you see that there was no significant differences between such combination therapy, because you see that bias in this case associated with 0.2, but you remember that when we characterize medical trials, you should remember about only 5% mistakes it's necessary for evidence results. So you shouldn't use two drugs in cases with fever. Case number 2 associated with heparin in venous thromboembolic disease. As you see, it's a systematic review from Crane library. You see evidence level 1, 2 pluses, and you see that we have a lot of publication associated with this problem, and each addressing a single explicit clinical question. And I demonstrate you 3 main clinical questions, like what is the best strategy for preventing this condition, venous thromboembolic diseases in high-risk situations. Then, what is the best treatment for this condition, and is the treatment best given in a hospital or home? What do you think about this situation? You should remember that when we characterize approaches to evaluate medical diseases, we use 3 terms: prevention, diagnosis, and treatment. In this situation, you see that when we describe situation with prophylactic treatment with heparin reduced use of venous thromboembolic disease in high-risk patient, use a low molecular weight heparin in patient with established thromboembolic disease is associated with fever, thrombotic complications, a lower mortality, and a lower risk of hemorrhage. And you see that when we describe a dosage, twice a daily dosage is preferable to once daily for such patient. And you see that when we recommend our patients stay at home and use this therapy, this situation or this approach is associated with better outcomes than in situation when we try to hospitalize these patients and then they receive the treatment. And you see that exposure to specific risk factors such as immobilization, lower limb injury, surgery, and acute severe infection results in a dramatic increase in risk. And you see that deep vein thrombosis and pulmonary embolism are main causes of death and disability for our patient. This slide demonstrates different types of epidemiological studies. It's necessary for your understanding which studies you should use for your clinical trials, or when you read different professional publications. You see that we have two types: experimental, like randomized controlled trial, the gold standard in evidence-based of medicine. And when we try to prepare our national guidelines, we use randomized controlled trials for describing different approaches in diagnostic, treatment, or preventive sphere. And there are two types: observational, and you see that they include different individual-based and population-based, like ecological, this population-based study, and individual, when we characterize such types like cross-sectional, case control, and cohort, when we describe prospective part of the study. What you see? You see that different types of observation and intervention studies characterize different positions, like exposures, genius, behaviors, individuals, and these positions are compared to individuals without their diseases. When we characterize case control, we have two groups: exposure group and without exposure factor group controls, and then we compare their results in one group with the results which we got to another group. Cohort, a group of individuals with and without a particular exposure, are followed to compare disease outcomes. Its usual cohort studies is prospective study, when we have two groups and one group receive or has risk factor, and then we follow for this experimental part, and then we compare two groups between each other and demonstrate different results in every group. When we characterize intervention, you see clinical trials, I mean randomized clinical trials, when patients receive different drugs, so vaccines and so on, and then we compare with patient without such interventions. And you see community trials, community participants in a behavior intervention, a screening intervention, and the others. The main position which we should to discuss during this lecture includes different stages of clinical trials, and you see the first stage, the preclinical trials, In some cases, you may see name like laboratory studies includes two parts: cell studies and animal studies. And you see, when we characterize cell studies, you see there are often the first tests done on a new treatment. And you see that these studies may be done on human cancer cells or animal cancer cells, and to see if it might work. Researchers look for effects of a new treatment on cancer cells that are growing in a lab dish or a test tube, and so on, so on. And the next variant, animal stages, and you see the treatments that look promising in cell studies are tested next on cancers in live animals. And this gives researchers a good idea how to save the new treatment is in a living creature. And you see that preclinical studies give a lot of useful information for us, but not all of that is needed, because humans and mice can be very different in the way they absorb, process, and get rid of drug or treatment. And you should remember that there could also be side effects and other problems that didn't show up when the treatment was used in mouse, but could show up in people. And you see the later variant, clinical trials. You see that clinical trials includes 4 stages, 4 phases. The first stage is associated with such as position like safety. You see that duration includes several months, and this phase this phase evaluate safety, the first position, and the next position gives information about how a drug interacts between the human body. If this phase demonstrate good results, we move to phase number 2, and this phase we try to analyze, further evaluate safety, monitor side effects, check which dose works best, check effectiveness. If we're having problems with results on this phase, we move to phase number 3, and you see that this phase demonstrate duration several years, confirm effectiveness, monitor safety, and another position, its phase include more patient for demonstrating different results. And the later position, phase number 4, post-marketing, safety and efficacy. And this phase associated with drugs effects in various population and any side effects associated with long-term use. For your understanding which types of different design you should choose for your professional level, you should remember about aims of evidence-based medicine, clinical epidemiology. And this aim includes 5 positions. The first, building skills and capacity in defining clinical questions, and identify relevant evidence, critically praising evidence, applying evidence to support improved clinical decision making and patient outcomes. Their position number 2 is associated with different developing and exploring innovative methods, of course. The position number 3, demonstrate different clinical research questions and performing meaningful clinical trials. Then developing approaches to minimize wasteful clinical research, and the final position, development methods to improve the timely translation of clinical evidence into real-world practice. And you see that medical staff will support advanced and evidence-based medicine, evidence-informed decision making, and apply clinical research for the purpose of improving patient outcomes in real-world setting, because it's necessary for our patient, for us, like a medicine. And the final slide for your understanding this topic, I want to demonstrate you levels of evidence, and you see that this pyramid includes different parts, like animal stages, expert opinion, then case series or case reports when we describe the same situation, the same condition, more than one patient, maybe 2, 3, or 5, or 10 patients. And then we try to form case control studies, like a retrospective part, like a pilot studies for our understanding risk factors, or maybe different errors in our treatment when we use different drugs. Then we formed prospective cohort studies, and find different risk factors and triggers. Then the gold standard randomized controlled trials, and then we try to use information from different randomized controlled trials. We receive such publication like systematic review. It's a very good professional practice to read systematic reviews or meta-analysis for your professional level. It's developing your skills and your knowledge in your professional sphere. Thank you for your attention. Be happy always.